Folks, welcome back. My name is Kweku. If you're new around here, I do medication reviews and I talk about healthcare topics as well. If you find such information useful, please go ahead and hit subscribe and also activate notifications such that you are alerted when new content is released. Today, I'll be reviewing the medication Trulicity. As usual, we'll take a look at what it is or the description and uses. We will also delve into the side effects, some precautions, and some best practices as well. Just a quick reminder though that this and all my other videos are for informational purposes only, and they are not intended to be a substitute for medical advice from your physician. So what is Trulicity? Well, Trulicity is described as a synthetic glucagon-like peptide 1 receptor agonist, or GLP-1 agonist for short. It belongs to a class of anti-diabetic agents called incretin mimetics. That is, it mimics the action of incretin. Incretins are endogenous compounds or hormones that the body produces in response to food. Incretins enhance the production of insulin. So when you take a shot of Trulicity, and by virtue of the fact that Trulicity is mimicking the action of incretin, insulin production is also enhanced, and that leads to more effective glycemic control. Trulicity is also known to reduce the secretion of glucagon. Now, glucagon is the main hormone responsible for the conversion of stored glycogen, usually in the liver, into glucose, which can be released into the bloodstream. So you have a twofold activity where your body is producing more insulin for beta sugar or glucose control, and also you're preventing your body or reducing your body's ability to kind of put more sugar or more glucose into the system by limiting the action of glucagon. With respect to uses, Trulicity is FDA approved for the management of type 2 diabetes and not type 1. And I say this because your body has to have the ability to still produce insulin. Trulicity's action depends on your ability producing more insulin. For that reason, Trulicity is not approved for use in people with type 1 diabetes. Trulicity is also used as a prophylactic or to reduce the mortality or the risk of death in certain type 2 diabetic patients who have established cardiovascular disease or who have multiple risk factors for cardiovascular disease. Dosing typically starts at 0.75 milligrams given subcutaneously once a week and may be increased to a max of 1.5 milligrams subcutaneously once a week if additional glycemic control is needed. With respect to side effects, the majority of reports included some kind of GI or gastrointestinal issue. Some of the side effects reported together with their relative rate of occurrences included diarrhea, nausea, vomiting, abdominal pain, anorexia or decreased appetite, dyspepsia, constipation, flatulence, and gastroesophageal reflux disease were all reported among people taking Trulicity. With respect to precautions and warnings, the first one that I want to tackle is the fact that Trulicity and all the medications in its class have a warning, a black box warning that says that it may cause tumors in the thyroid, including thyroid cancer. So therefore, if you are somebody who's taking Trulicity, you need to watch out for possible symptoms of that, which include a lump or swelling in the neck. If there's any trouble swallowing, there is any hoarseness or shortness of breath, these may generally not be a good sign. It will be best to discuss this with a doctor. For that reason, if you or any family member have a history of thyroid cancer, sometimes called medullary thyroid carcinoma, you may not necessarily be a good candidate for that class of medications, but definitely discuss with your doctor to see what your options are. I just want to clarify here that I'm not talking about people that have a thyroid condition. Say maybe they have hypothyroidism or hyperthyroidism, or they take maybe like a Synthroid for their thyroid issues. No, this is not what we're referring to. We're referring to people who have actual history or a family history of a thyroid cancer, not maybe an underfunctioning thyroid. That is not what this warning refers to. Other warnings and precautions include hypoglycemia. So hypoglycemia has been known to occur, especially in people that take other diabetic medications, say maybe an insulin or sulfonylurea. So those people are usually at a relatively higher risk of developing hypoglycemia, and therefore a dose adjustment may be necessary. Pancreatitis has also been reported in people taking Trulicity, and therefore monitoring is recommended. And usually a discontinuation is warranted if there is actual evidence of pancreatitis occurring. People with a history of angioedema should also be cautious when they use Trulicity. Now, angioedema is an allergic reaction which is characterized by a swelling, usually of the face or of the throat, due to the rapid accumulation of fluid. So if you already have a history of angioedema, you need to let your doctor know. You may not necessarily be a good candidate for Trulicity, as Trulicity is known to cause angioedema in some people. Also, due to its ability to cause a lot of gastrointestinal side effects, Trulicity should generally be used with caution in people who already have existing gastrointestinal issues, especially people with like gastroparesis. Now, gastroparesis is a condition in which your stomach does not empty itself of food in a normal fashion or in a timely manner, and therefore it may lead to things like heartburn, nausea, and vomiting, which are already side effects of Trulicity. So caution should be exercised in people who have existing gastrointestinal issues. So despite these side effects and warnings, Trulicity is still very widely prescribed. That's because it has also a lot of benefits. Some of these benefits include improved glucose control, leading to a reduction in A1C. Some studies point to a significant reduction in A1C among people who have taken Trulicity over a 6-month period. Trulicity has also been known to cause weight loss. Although Trulicity is not a weight loss medication, some people may lose weight when they stay on Trulicity, and some of these people are able to keep it off. So it offers some additional benefits as well. So there you have it, folks, a high-level overview of Trulicity. I hope you found it beneficial. If you did, please give it a thumbs up and share with somebody also who may find it beneficial as well. As always, thank you for staying through. Please hit the subscribe button if you haven't already done so, and I'll catch you on the next one. Thank you.